What's your date of birth, Ebony?
July 20th,
20.
2000.
2000. When I ask you pain scale from 0 to 10, being 10 the most intense, how would you classify your pain? You got none. Yes or yes? Okay. When we're doing an assessment, guys, and I know this one has a wound care right here, we're going to be assessing our patient with normal assessment. Does it make sense?
Mm-hmm.
So everything is going to be normal, so that way when we're going to do an assessment in the outside, we could recognize which ones are the negative one, okay? I'm going to make believe that I'm looking at the patient's armband. There's none right here. But for purposes of CPs, I want you guys to think and recognize that I'm going to do that, okay? Been working on my armbands, okay? And you have no allergies to food, medication, or latex, okay?
Okay.
And let me get my gloves. You're right there on the floor. Medium or large, whatever you want to give me.
Oh, no, not those.
That's too small.
There's some on the table.
These are extra small. They're on the box over there.
Medium. Medium? That's fine with me. Gonna put it right here. Okay. Gonna knock, guys. It'll count up 3. 1, 2, 3. This is NSG 3160. Health assessment. Time frame 20 minutes. I'll be going slow so you guys can capture. It's only including the health assessment portion, the assessment of the lung sound, the assessment of the cranial nerve, and the assessment of the reflex. It's going to be separate, okay? So just so you can have knowledge, okay? I'm going to knock on the patient's room.
Come in.
Okay. Good afternoon. My name is Gabe. I'm a nursing student from Galen College of Nursing. I finally wash my hands, okay, when I come into the patient's room. And I am here to follow the order that Dr. Smith gave me to perform a physical examination for you since you're admitted last night. Is there any cultural consideration that I need to be aware of, that me being a male and you being a female, that I'm gonna be touching you and exposing you?
No.
Okay, that means you're giving me permission, right?
Yeah.
Okay, I'll be exposing your upper torso and your lower torso, and I'll be evaluating your private parts, okay? Okay, so that's very much for understand. In a scale of 0 to 10, being 10 the most intense, are you experiencing any pain right now?
It's a 0.
You don't have no pain, thank you. And another question I would like to ask you, Mrs. Green, do you know where you at?
Yes, I'm at Galen Hospital
Okay, thank you. And do you know why you're here?
to have a full physical assessment.
Okay, thank you, Mrs. Green. And I would like to also ask you, do you know who is the president?
Barack Obama.
And do you know what date is today?
Today is July 20th, 2022.
And that's today, I'm assuming, and I could see it, that your birthday was today as well. Happy birthday,
Thank you.
okay? So that's very important to understand. Do you have any allergies to food?
No.
Do you have any allergies to latex?
No.
Do you have any allergies to medication?
No.
Okay, good. I've addressed my patient's important aspect, so it's good to continue. I'm gonna look at my patient at this moment in time. I see that my patient's overall hygiene is well groomed. He's clean, okay? She's clean, okay? She is well groomed. She has a beautiful donut with a good twist in the hair, okay? Her skin is warm to touch, okay? Not diaphoretic, okay? She's not dirty. She doesn't exhibit any type of respiratory distress or coughing at the moment. I'm going to touch the patient's face with your permission, Mrs. Green. I'm going to state the patient's skin is warm to touch and is dry, okay? Okay, so she has no evidence of any hair loss. I'm going to raise the bed to a working height. So I'm going to bring my bed to a working height so I could perform my second identification. Putting my order side by side with my patient's armband and allergy band. So I have right here Emily Green. She was born on July 20, 2002. And her medical record is 1, 2, 3, 4, 5, 6. Okay. She has no allergies to food, medication, or leg test. I have the correct patients. It's safe to continue with the procedure. So the next thing I'm gonna do is I'm gonna place my patient on a 45-degree angle. So I'm gonna set her JBD. Okay. This right here. Okay, Mrs. Green, can you please look to your left side? Looking to the left side. I'm gonna palpate the carotid. Okay. I see no distended JVD. I'm gonna have the patient look the other side. I'm gonna palpate the carotid. Pose as well for 1 minute. The patient has 88 plus 2 equally in both sides, and the patient doesn't exhibit any sign of JVD at the moment. Okay. Okay. So what I'm gonna have to do is I'm gonna be palpating your face, Mrs. Green, if it's okay. Let me know if you have any pain or tenderness, okay? Or crepitus. Any pain or tenderness, Mrs. Green? I'm gonna go to the cheeks. Any pain or any tenderness?
No.
And I'll be doing the patient's lymph nodes separately, guys. I'll be noticing right now that there is no swollen glands already in the jawline as well. I'll be palpating the patient's thyroid. There's no edema, everything is normal for the moment being, okay? Then I'm gonna have to look at the patient's eyebrow. There's no hair loss, okay? I'm looking at the patient's nose. I'm gonna dim the light. I'm gonna look inside the patient's nostril. I see no deviated septum. I see no polyps. I see no drainage, no red in the area, okay? Okay, so that's very good. Okay, Mrs. Green, can you please open your eyes for me? I got gloves on. I'm opening my patient's eye. I'm going to state that the patient's sclera is white, conjunctiva is pink with no drainage in both eyes. And I'm going to say that the patient's eyes measure 3 mm at the moment. Okay, and I previously did already the patient's cranial nerve, and the patient has equal pupil, which are equally round, reactive to light and accumulation. Okay, so the next thing I'm going to do, I'm going to have my patient open the mouth. Can you please open your mouth, Mrs. Green? Okay, I see that her uvula is midline to her trachea. Are these your teeth, Mrs. Green?
Yes.
Okay, I see that her dentures is perfect. Is it intact? Doesn't show any type of rot tooth, or the patient has no sores or lacerations in the throat or the cheeks. The patient's tongue is pink with no evidence of any signs of any infection, which will indicate with white spots. Okay? Okay? Teeth are intact. There's no halitosis. The patient has good breath. Okay? That's good. And then what I'm going to state that the patient's lips are pink and supple. They're not cracked and they're not brittle. Okay? She got good hydration. Skin color is normal for ethnicity. Mrs. Green, I'm going to pass down your gown if that's okay with you.
Yes.
Okay? I'm going to pass down the gown to halfway through. I'm going to see that her chest is normal for ethnicity. They're equal in size and contour. Okay? Warm to touch. Skin color normal for ethnicity. Okay? I see no bumps, no lumps, no laceration. Anything that could indicate me any type of abnormalities. Okay? So what I'm going to do is I'm going to take my stethoscope. I'm going to localize my patient's landmarks for the respiratory system. I'm going to go right here at the trachea. These are called tracheal or bronchial. Bronchial,
I move behind you.
bronchial as well. Okay? Then I'm going to go to what we call the bronchiovesicular, bronchiovesicular. And the rest of the lung field here, without going through where the bronchiovesicular and bronchial is called the vesicular area. This is vesicular area, okay? At this moment in time, I'm going to say the patient's hair is equally distributed, okay? I'm going to put my patient flat in the bed so I can set her AP diameter. I'm going to say that her costal angle is is 1 to 2. 1, 1, 2. That's indicating to me that the patient doesn't have any type of barrel chest, that the patient has COPD or emphysema. Okay, I'm going to place my hands right here on top of my patient in the xiphoid process. In the count of 3, Mrs. Green, I want you to take a deep breath for me. 1, 2, 3. Take a deep breath. Okay, I see that my arms didn't separate too much. The patient separated in less than 90-degree angle. That's indicating that the patient's lungs are equal. The patient don't have any type of collapsed lungs. Okay, I'll do the same thing in the back. Okay, like I said, I see my patient with no difficult breathing. Okay, so what I'm gonna do is I'm gonna assess my tense space of my lungs in the front. Okay, I'm gonna assess now your lungs, Mrs. Green. When I count to 3, you're gonna start counting, okay? You're gonna breathe, take a deep breath, and when I move my stethoscope, okay? 1, 2, 3, take a deep breath. 1, take a deep breath. 2, take a deep breath. 3, take a deep breath. 4, take a deep breath. 5, take a deep breath. 6, take a deep breath. 7, take a deep breath. 8, take a deep breath. 9, and take a deep breath. 10. Good job there. So what I'm gonna do now is I'm gonna be assessing your back at this moment. Going the other side. Help me sit my patient up. Oh. Okay. So what I'm gonna do now is I'm gonna assess the 10 landmarks from the back as well. Mrs. Green, when I ask you to take a deep breath, you're gonna take a deep breath for me. Okay? And then as I move my stethoscope in the count of 1, 2, 3, take a deep breath. 1, take a deep breath. 2, take a deep breath. 3, take a deep breath. 4, take a deep breath. 5, take a deep breath. 6, take a deep breath. 7, take a deep breath. 8, take a deep breath. 9, take a deep breath. 10. Good job there, Mrs. Green. And now I'm gonna state that the patient's anterior and posterior has normal lung sounds, no adventitious lung sounds were auscultated, okay? So what I'm gonna do is I'm gonna put my patient's back down again. I got my patient flat. I'm gonna cover the chest again. And I'm gonna expose her abdomen. But before I do the abdomen, I'm gonna look at her arms, okay? I'm gonna state that the patient's skin color is normal for ethnicity in both arms, okay? Hair is equally distributed in both hands. I see no evidence of calluses on the hand. There is no clubbing, okay? I'm gonna state the nail bears are less than 3 seconds in both hands, and the patient has a good manicure. The nail bears are pink. It goes real quickly, what we call rapid recoil back to his normal color. The patient has no clubbing of the fingers. Okay, no calluses like I said. Okay, good job there. I'm gonna have you close your eyes, Mrs. Green. Close your eyes. Tell me what I'm touching.
Nothing. Oh, I thought you told me to. I'm sorry. My thumb on the right hand.
Okay, and what I'm touching now, Mrs. Green?
Middle finger on my left hand.
Your birdie finger, right? Okay, keep it there. Keep your eyes closed. Can you please raise your right hand? Bend your left elbow. Good job right there. Now I'm gonna ask you to squeeze my finger. Squeeze that how you can. Oh my God, you got strong hands. Give me. Don't do that. You're killing me. So I'm gonna say at this moment in time to break your pulses. I'm gonna do it bilaterally because we're comparing them, okay? So I'm taking the patient's brachial pulse. The patient has 88 plus 2 equally bilaterally. I'm gonna go to the patient's radial pulse. I'm gonna palpate it for 1 full minute, okay? Patient, 1 full minute has elapsed and the patient has 90 pulse per minute, okay? And plus 2 equally bilaterally, okay? Okay, so we're gonna continue to go down, Mrs. Green. With your permission, I'm gonna expose your abdomen. And at this moment in time, I'm gonna wash my hands and put my gloves on. my gloves on. I wash my hands. It's very important to understand, guys, when we go into the abdominal area, we consider this a blind spot. And you don't know if your patient has any vaginal drainage or any STDs, the same with the male, or then have any type of drainage. Okay, so I'm looking at my abdomen, guys. I'm gonna be dividing my abdomen in 4 quadrants, okay? Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. What I'm gonna do is I'm gonna start auscultating my patient's bowel sounds for 1 full minute. I'm gonna start in the lower quadrant going up. I'm going to the left, self-correct. Right lower quadrant for 1 full minute. I'm gonna go to the right upper quadrant for 1 full minute, 2 inches away from the umbilicus. I'm gonna go to the left upper quadrant, 2 inches away from the umbilicus for 1 full minute. I'm gonna go to the left lower quadrant for 1 full minute. And I'm gonna state the patient has normal active bowel sound. I'm gonna self-correct. Very important thing, self-correction. I did one thing that I shouldn't done. I shouldn't have put my stethoscope first because I need to do what, guys?
Look.
Look. When we do an assessment of the abdomen, we do look, listen, and feel. We look first. The patient doesn't have a triple A, okay? If he would have had what she would have had, I would have already ruptured her and she would have been dead. Make sense? So remember, guys, is that the way your abdomen usually looks, guys? So that's very important. Like I said, guys, don't worry, I'm gonna be repeating this again in the future, okay? So I don't see anything at the moment, so this time what I'm gonna do is I'm gonna divide my abdomens in 9 regions and I'm gonna name the regions, okay? So that's 1 right here, 2, and 3, okay? So I'm gonna start with the right hypochondriac, the epigastric, and the left hypochondriac. I'm gonna go to the left lumbar, umbilical, and the right lumbar. I'm gonna go to the right iliac or right inguinal. I'm gonna go to the hypogastric, and I'm gonna go to the left inguinal or the left iliac. Okay. Do you have any pain or any tenderness in any of those areas, Mrs. Green?
No.
So I'm gonna cover my patient again, and I'm gonna palpate my bladder in 3. I see my bladder is not distended, but I'm gonna palpate it now. 1, 2, 3. I'm gonna state my patient's bladder is non-tender, non-distended. Did you have any pain, Mrs. Green, in a scale of 0 to 10?
No.
Okay, so that's okay. So the patient is a female, okay? She has no pain, okay? So what I'm gonna do is I'm gonna go down to the lower extremity. I'm gonna take my gloves off, and I'm gonna wash my hands, okay? There you go. I don't need my gloves no more, okay? The skin color is normal for ethnicity, warm to touch. I don't see no edema or any swollen knees, ankles, or foot, okay? In both legs as well, guys. Hair is equally distributed, okay? So there's no pain, no lacerations, or no tenderness. Skin colors, like I stated, is normal. I'm gonna hear the patient's posterior tibia for 1 full minute. The patient has 92 plus 2 equally bilaterally. Okay, I'm gonna do the dorsipedialis. The patient has 94 plus 2 equally bilaterally in both of the legs, okay? I'm gonna be pushing my patient's leg. I see no any type of edema, okay? I'm looking at my patient's toes. There's no evidence of any type of fungus, no dryness. The patient has a good pedicure. Nail beds are pink, okay? I'm gonna squeeze them. All 10 toes has less than 3 seconds of cap refill with a normal refill and brisk. So now I'm gonna be assessing my patient's hands. Okay, I'm gonna be looking at my patient's turgor. Okay, if the patient was dehydrated, he will do what we call a tenting. Okay, there's a possibility I have a little bit of tenting. Let me see yours, Mrs. Ebony. Put it right there. Oh God, you got a beautiful tenting right there. She has a rapid recoil. If you notice mine's guy, mine takes time and it stays there like a little tent. It's not fast as Mrs. Green, okay? So that's indicative that your patient has a possibility of dehydration and not drinking a lot of water, okay? So how you doing, Mrs. Green, up to now?
Good.
You're doing okay? Okay, let me continue with my assessment. I'm gonna have you, okay, let me have you stay right there, Mrs. Green. So what I need you to do is, I'm gonna push your legs and you're gonna push my legs just like I did with your hands. You squeeze them. Okay, I'm gonna push them down, pull them down, you're gonna push them up, okay, Mrs. Green? Okay, I'm pulling down. Whoa, okay, you got good strength in the leg. Okay, so what I'm gonna do is I'm gonna push up and you're gonna push down. Whoa. Mrs. Green, do you have a Maserati? You got lead foot. Okay, you are a good driver, I could tell. So very important she does that correctly, guy. Okay, so the next thing I'm gonna state that the patient's foot is not cracked. There's no dryness in the patient's sole. Okay. In a minute, I'll be putting you your non-skid sock, Mrs. Green, okay? But first, I need you to do one thing. Can you please wiggle your toes? Wiggle, wiggly, wiggly, wiggly. Wiggly, wiggly, good. Can you please bend your left ankle? Good job. Can you bend your right knee? Can you raise your left leg? Good job, Mrs. Green. I'm going to state at this moment in time that my patient responds to simple commands in upper and lower extremity with equal strength, okay, and tactile stimuli bilaterally upper and lower extremity, okay? Good job. How you feeling, Mrs. Green?
Good.
You're doing good, okay. So what I'm gonna do is I'm gonna turn you to the side, Mrs. Green. I'm gonna look at your back if that's okay with you, okay? Okay, turn around this way. Okay. I need to cover her boobie. Okay. I'm looking at her back. Skin color is normal for ethnicity. I see no evidence of any type of lacerations, mole, or any critical element that could indicate me that my patient has any sores, things like that. I'm gonna go down to the patient's sacrum area. I'm gonna state the patient doesn't have any evidence of edema in the sacrum area where we start performing and developing our first broken skin or pressure ulcers. We're gonna look at the patient's greater trochanter's bony permanence, no broken skin as well. Okay, I'm gonna see this patient. My patient is a female. I see that the patient doesn't has no excessive amount of hemorrhoids. I see that my patient has no vaginal discharge. Okay, patient didn't say anything abnormal going up. Mrs. Green, I'm gonna ask you some questions. They're gonna sound a little bit odd, but it doesn't matter when we ask them. When was the last time you had a bowel movement?
Yesterday.
Yesterday? Did it have any peculiar odor?
No.
What was the color of it? Okay, what was the amount?
The amount?
Yes.
I'm not sure.
Large, medium, small.
Medium.
Okay. Okay. So how about urine, Mrs. Green? When was the last time you urinated?
About 2 hours.
Pardon me?
About 2 hours.
Like 2 hours ago? Did you have any burning sensation?
No.
Did it have any foul odor?
No.
So how much was it? Like a 8-ounce cup?
Approximately 9.
And what was the color?
It was light yellow.
Like yellow? Did you see any blood, any particulate, or any sedimentation?
No.
Do you suffer from what we call in nursing or in nursing education about stress incontinence, that when you sneeze or you laugh, you have an accident and the pee comes out?
No.
Okay, that's good. Okay, I'm gonna ask you another personal question. When was the last time you did yourself a breast examination?
3 months.
3 months ago?
Mm-hmm.
And do you do your breast examination on a monthly basis?
I do not.
You don't? So one of the things that I'm gonna be telling you, Mrs., Green, can I ask you again, what was your age?
July the 20th.
No, what your age, Mrs. Green?
20.
Okay, you're 20, you should be doing your breast examinations after your period, 7 days after. Okay, make sure if you didn't find any type of nodules and things like that, what you're gonna do is you're gonna do it in a circular motion, okay? Please try to do that after your period, okay? It's very important, okay? So do you have any question at all now so I can continue?
No.
Okay, so now what I'm gonna do is I see no sores in the heels. I'm gonna put the patient's socks because I'm gonna stand my patient and I'm gonna walk them. Okay. Mrs. Green, the doctor told me you were complaining of knee pain. Okay. That you had a knee injury when you used to be an athlete, used to run when you were in college. Okay, so I'm gonna show you what you're gonna do for exercises, okay? Okay? That's gonna help you. You're gonna do that exercise at least once every 2 to 4 hours while you're watching the TV, okay? Just make sure you do it and you do the exercise, okay? You can do it sitting or standing. It's up to you or when you're in the shower, okay? Any other questions?
No.
So let me put you flat, okay? My patient is flat. I'm assessing his pulse. Patient has 88. What I'm gonna do now, I'm gonna sit my patient, gonna help him out. I'm gonna sit my patient right here. I'm sitting my patient. I'm gonna assess my patient's pulses bilaterally. How you feeling, Mr. Green?
Feeling good?
Feeling good? Okay. Not feeling dizzy?
No.
Okay, I'm gonna ask you a question. Do you think so you could stand up and walk for me 5 steps that way and 5 steps back? And then I'll be doing the rest of your back assessment. My patient has 86 plus 2 equally bilaterally. My patient state he is not feeling dizzy, he's feeling okay. Can you please get off the bed? The patient's bed was low. There you go. How you feeling, Mr. Christopher? You okay?
Good.
Say turn around to the opposite side right here. So I'm gonna be opening his hospital gown. I'm gonna have you, can you please grab on your knee? Bend it. Okay, I'm gonna state the patient has, no, both hands, Mr. I don't see no evidence of scoliosis. I see that the patient doesn't have any evidence of kyphosis and any evidence of lordosis at the moment. Okay, get up. So what I'm gonna do now, Mr. Green, I'm gonna assess your lungs in the back part. I did your front. Now I'm gonna do the back. In the count of 3, you're gonna take a deep breath as I move my stethoscope. 1, 2, 3. Take a deep breath. 1. Take a deep breath. 2. Take a deep breath. 3. Take a deep breath. 4. Take a deep breath. 5. Take a deep breath. 6. Take a deep breath. 7. Take a deep breath. 8. Take a deep breath. 9. Take a deep breath. 10. Stay right there with the Green. I'm gonna set the patient AP diameter costal angle. The count of 3, Mr. Green, you're gonna take a deep breath from me, okay? 1, 2, 3, take a deep breath. Okay, I'm gonna take the patient's back of the lungs equally bilaterally, okay? And less than 90 degree, anteriorly and posteriorly with no abnormality, has an equal rise and fall, okay? How you feeling, Mr. Green?
Good.
Okay, what I need you to do, Mr. Green, turn around for me. This way right here. I'm sorry, this way. Can you please walk for me 5 steps that way and 5 steps back? I see that my patient has no abnormal gait. The patient has good gait, no limping. Any pain or any tenderness, Mr. Green?
No.
Okay, like I said, Mr. Green, the doctor was telling me that you had a bad left knee. So I'm gonna show you what you're gonna be doing, okay? So this is what you're gonna do. Okay, I need you to repeat me as I do it, okay? Like I said, you're gonna do it like 4 times and while you're watching commercials, you're gonna be flexing, extending, okay? Okay, we're gonna do adduction, adding, and this is called adduction, taking away from inside. This is the hip, okay? And the last one is circumduction, where you're putting your legs in circular motion. Do you think so you could do that exercise, Mr. Green?
Yes.
Okay. Do you have any questions for me?
No.
Do you want any coffee or any water, juice?
Take coffee.
Okay, coffee. How much you like? How would you like it?
Black.
Black. Any sugar? Okay. So black. Okay. Okay. So Mr. Green, I'm gonna lay you back down in the bed. I'm putting you back in the bed. Mr. Green, do you want to stay with your socks on, or do you want me to take them off?
On is fine.
You gonna take them with them on?
On is fine.
Okay. It's getting hot in here. Let's get all our clothes off. So I'm leaving them on. If you get hot, just let me know later on, okay? So I covered my patient the way she was. Well, he was, I'm sorry. I'm gonna lower the bed to the lowest position. Extra. So I'm gonna make sure that the side rails are up ×2. I'm gonna make sure that the patient's core light is within reach. Oh, don't pull it hard, it's gonna break. I'm putting it in her hand. This is green. There you go. Okay. So I got that. I finished everything. Okay, Mrs. Green, I'll bring you your coffee, no sugar, no creams, okay? Just give me 2 seconds while I brew the coffee, because we finished the coffee, okay? Anything else, Mrs. Green?
No.
So what I'm gonna do is I'm gonna start brewing the coffee, and then I'm gonna start doing your documentation. I'll bring these assessments to the doctor, okay?
Thank you.
Stop. Now,